Hey mama, if you have been wondering how to prevent diastasis recti during pregnancy, or maybe you've been told that certain movements or certain exercises, maybe even getting out of bed the wrong way can make it worse. But I want to help clear up some of this confusion. Because the truth is, you cannot completely prevent diastasis recti during pregnancy. I know that might not answer the question in the way you're hoping for, especially when there is so much information online promising to help you avoid it altogether. As a pelvic floor physical therapist, I see so many women carrying guilt or fear about diastasis recti because they think that they caused it or they didn't do enough to prevent it. But here's what I want you to know. Diastasis recti is a normal adaptation of pregnancy. As your baby and uterus grow, your abdominal wall is going to naturally stretch to make room. In fact, some degree of abdominal separation occurs in 100% of full-term pregnancies. So this separation is a normal adaptation of pregnancy. It does not mean that you've done anything wrong or that your body is failing you. And here's the good news. While we can't guarantee complete prevention, there are absolutely things you can do during pregnancy to better support your changing body. Building strength, learning how to support your core can help reduce pain and pelvic floor symptoms during pregnancy, while also setting the foundation of improved core healing and recovery in that postpartum period. I'm Dr. Towne, pelvic floor physical therapist, prenatal and postpartum exercise specialist, and mom of almost 4. My goal is to help you feel strong, supported, and confident going through pregnancy and postpartum recovery. And before we jump in, if you are looking for pregnancy-safe workouts and pelvic floor guidance, make sure that you like and subscribe. All right, mama, let's get into it. Diastasis recti is the stretching or the thinning of the linea alba, which is the connective tissue that runs between your rectus abdominis on the right and the left side as your belly expands in pregnancy. And despite what social media sometimes tells us, it is not simply caused by weak abs or the wrong exercises or getting out of bed the wrong way. As your belly grows, your abdominal wall has to adapt. Your uterus expands and the pressure inside your abdomen increases. And your connective tissue, this tissue here, stretches to make room for your growing baby. So for all full-term pregnancies, this results in some degree of abdominal separation. And here's the important part. You cannot completely prevent a normal adaptation that your body needs to make during pregnancy. I like to shift the focus from what not to do to what you can do to support your body during pregnancy and prepare for recovery. While we can't guarantee that diastasis recti won't happen, we can focus on strategies that support your body throughout pregnancy. Prioritizing things like pressure management, deep core function, and maintaining strength can help not only reduce pain, but also manage symptoms. And that is exactly what we're going to work on in these exercises today. As we go through these exercises, I want you to focus on your brain-body connection to the core. So stop or modify if you notice any of the following: pain, hard coning or doming in the midline, increasing pelvic floor pressure, dizziness, contractions, leaking, or anything that simply just doesn't feel right. Pregnancy is not a time to avoid your core altogether or to keep doing the same core exercises you were doing before. It is time to adapt your approach and support your body through the incredible changes that it's going through. And if your belly or your pelvis are feeling especially heavy or unsupported, many moms, including myself, have found that wearing a pregnancy support band or supportive shorts and leggings can actually make movement and exercise feel so much more comfortable. I'll link a few of my favorites along with discount codes in the caption below. So instead of asking, how do I prevent diastasis recti? I want you to start asking, how can I best support my core during pregnancy? Because when we shift from fear and avoidance to support and preparation, then everything changes. All right, mama, let's get started with the exercises. Grab a ball and put it right behind your low back as you're gonna lay in a supported position on your elbows and with your back resting on that ball. We're gonna inhale through your nose. As you exhale, contract your core as you march one knee off of the floor. Hold a couple seconds, lower, relax, reset. Inhale, exhale. Contract that deep core, lift the other knee up, hold, and then keep alternating sides. So inhale through your nose, exhale, contract, lift, hold. So the knee does not have to come up very high off of the ground. And if you don't have a ball, you can still just do this on your elbows here, supported in that elevated position. Really focus on pulling those hip bones together as you give baby a deep hug and as you lift that knee up off the mat. Couple more here. Last one. Big breath. Contract and lift, hold. Staying balanced on those hip bones and then slowly lower down. For this exercise, go ahead and grab a small foam block or a small ball and put it underneath your right knee. Your left knee is out in front of you and you're gonna come down onto your left elbow here. We're gonna inhale through your nose. As you exhale, you're going to push your right knee into the foam block as you lift your left hip off of the ground. Hold there for a couple seconds and then slowly come back down. Inhale through your nose, exhale through your mouth. Lift those hips up off of the ground using those side abs, hold, and slowly return. So we're using a lot of our inner thigh on the knee that's pushing into that block or ball. And then we're feeling a lot of our side abs from the side that is facing the floor and lifting up off of that floor. Make sure you are breathing here. Again, always inhaling through our nose, exhaling through the mouth. We want to prevent breath holding here because that can often cause hard coning or pressure on the pelvic floor. Almost done here, you got it. It's okay to do a little shaking here. You choose how high you are lifting off of the floor. Higher you lift, harder it will be. Grab a small ball and put it in between your knees here. We're gonna put our hands right underneath our shoulders and our knees right underneath our hips. Inhaling through our nose, breathing into our back. As we exhale, we want to lift baby up towards our spine as we lift our knees up off of the floor and hold in a bear hold. So inhaling through our nose, lowering knees down, then exhaling, lifting knees up. As we contract our deep core and lift that belly up towards our spine. Now we're going to make this more complicated by adding hand lifts here. So inhale through your nose, exhale through your mouth. Lift belly up, lift knees up, lift one hand, lift the other hand, and then slowly return back down. Okay, inhale through your nose, exhale through your mouth, lift belly up, lift knees up, alternate which hand you lift with first. And if that hand lift feels too challenging, that's okay. Just hold it in that bear hold position with knees off. Inhale, exhale. Again, lift knees off. If you want to just hold it here, you can. If you want more challenge, the hand lift here, one on each hand, and then slowly come back down. Make sure you're breathing. Couple more here. Inhale, exhale, lift, one hand, other hand, slowly return. Big inhale through your nose, through into your back, exhale through your mouth. Lift belly up. Last one here. You got it, mama. Nice job. We're gonna go in a tall kneeling position with a ball between our knees here, and then go ahead and grab a dumbbell, like a medium-sized dumbbell. So inhale through your nose, breathing that 360-degree breath. Exhale through your mouth. As you exhale, give that nice baby hug. As you push the weight away from you, hold, and then slowly come on back. So inhale through your nose, belly expands, exhale through your mouth. Belly contracts, push weight away from you, and then return. If you get tired in that tall kneeling position, you can drop down in between, lift back up, exhale, push weight away. So we are pushing that dumbbell away from our body after every single exhale. If that dumbbell is too challenging, you can switch to an easier dumbbell, or you can always drop that dumbbell completely. Squeezing that ball gently between those knees and pulling those hip bones together to give that baby a nice squeeze and push away. Last couple. Again, come back down if you need to reset, or just stay up in tall kneeling. Nice job. Go ahead and lay on your left side with your head supported, and then you're gonna lift your top leg up or your right leg up as you crunch your right elbow up towards your right thigh. So inhale down, exhale up. Inhale down, exhale up. So when you lift that top leg, you should be feeling your top hip work as well as your top obliques or your side abs. Those are incredibly important muscle for us to stabilize the pelvis during pregnancy, and it is not going to really cause any further separation of that diastasis recti. So inhale down, exhale up. We want to keep that foot parallel to the floor. So we want to make sure that we're not lifting with toe. That's only going to be using the hip flexor. We want to be working that gluteus medius or side hip and side obliques. So inhale down, exhale up. Last one here, you got it. Hold and then slowly come back down. I hope this video helped you feel a little bit more confident and a little less fearful about diastasis recti in pregnancy. Your body is constantly adapting to support your growing baby, and the goal is not avoidance. Instead, it's learning how to support your body through all of the changes. If you want more guidance, then that's exactly what we help you with inside of the Strong Expecting Mama program. It is our pelvic floor PT designed program built around the same pregnancy exercises that I teach my patients and that I do myself for my own body. These exercises are designed to help you move safely during pregnancy, help you reduce common aches and pains, and prepare for labor and support a healthy postpartum recovery. Click the link below to start your free 3-day trial and see if it's a right fit for you. If this video was helpful, please make sure to like, subscribe, and sign up for notifications for future pregnancy-safe workouts and education. And send this video to another mama who might be worrying about diastasis recti, because a little reassurance and support can go a very long way. I'll see you in the next video.